Hello, in this video we're going to talk about Parkinson's disease, which is a neurodegenerative disease. About 0.3% of the population over the age of 40 has this disease. It's about 7.5 million people worldwide. So let's look at firstly the signs and symptoms of Parkinson's. And here I'm drawing a patient who presents with tremors, shaking. And he presents like this due to a condition called Parkinson's disease that affects the brain. The cardinal features of Parkinson's disease, there are four. These include tremors, rigidity, bradykinesia, postural instability. There are other features which affect the craniofacial areas, which include hypomimia, which is basically decrease in facial expression, dysphagia, hypophonia, reduction in basically the tone of the voice, volume. Other features include visual problems such as blurred vision and eyelid opening apraxia. Other features also include gait. You can have shuffling, festinations, and freezing. So all these signs and symptoms are a result of problems that occur within the brain, particularly in an area of the brain known as the basal ganglia. So let's just quickly revise some important anatomical structures of the brain. So here we have the fornix, which is an important part of the limbic system. We have the hippocampus, which is for memory, the amygdala for emotions. But we will mainly concentrate on this yellow structure here, which is known as the basal ganglia or the basal nucleus. Medially to the basal ganglia is the thalamus, which essentially is a connection between the cortex and the brainstem spinal cord. So again, Parkinson's disease is a result of problems that occur within the basal ganglia or the basal nucleus, because this area is responsible for muscle tone as well as the ease of movement. So it helps in a smooth movement and learned movement patterns. So let's just take a cross section, a coronal section of the brain here, and look at the basal ganglia in a bit more details and its components. So here we're looking at a section of the brain. Here in green is the thalamus, just to orientate where we are. All these structures in yellow here, they are part of the basal ganglia. So the basal ganglia is made up of the caudate nucleus, caudate putamen, the globus pallidus, of which we have an external and internal part. We also is made up of the nucleus accumbens, which I have not drawn here. And we also have the subthalamic nucleus and the substantia nigra, which consists of two parts. And just to complete this image, we have the amygdala here as well as the hippocampus. So we will mainly focus again on the basal ganglia, which is disrupted in Parkinson's disease. So what does the basal ganglia do? So let's just have a quick general overview of what it does. So here again we have the brain, and this yellow structure is the basal ganglia. Essentially what happens is the cortex, when it wants to initiate a movement, it will send signals first to the basal ganglia, and the basal ganglia will send signals back to the cortex, particularly the motor cortex. And then when the signals are sent back to the motor cortex can then, initiate these signals, send the signals down the spinal cord, and then, out through the ventral horn of the spinal cord to that skeletal muscle to, initiate a smooth, controlled movement. Okay, now let's look at that in a bit more detail. So again, the cerebral cortex it wants to initiate a voluntary movement. It will first send signals to the basal ganglia. And the basal ganglia will help in the subconscious control of subskeletal muscle tone, as well as the coordination of learned movement patterns. This information will then be sent back to the cerebral cortex through a loop. It will be sent to the thalamus first, and then the thalamus will send this info to the cerebral cortex. The cerebral cortex will then send the movement signals, the smooth, controlled movement signals down the spinal cord to the skeletal muscle. And thus we have a normal movement pattern. Two important parts in this diagram: the input from the cerebral cortex to the basal ganglia, and the output from the basal ganglia to the thalamus, back to the cortex. In Parkinson's disease, the output, number 2, there's a problem in the output, and thus we do not have a normal controlled movement pattern. It is not smooth. So now let us go back to the big diagram and learn about the interconnection that occur within the basal ganglia and the disruption that occurs and how this results in Parkinson's disease. So in this diagram, we're going to look at all the components of the basal ganglia. So to start, the caudate nucleus and caudate putamen is also known as the caudate striatum. So here, the rectangular structure I'm drawing is the caudate striatum. This is the cortex, and all these other structures here are part of the basal ganglia. We have the substantia nigra pars compacta, the globus pallidus interna, the substantia nigra pars reticula, the globus pallidus externa, the subthalamic nucleus, and the thalamus. Now I'm going to start drawing the interconnections that occur within this region. But firstly, I want you to learn 3 main points. The input from the cortex to the basal ganglia is to the striatum, to the caudate striatum first. So the input is to the caudate striatum. The output from the basal ganglia occurs in the globus pallidus interna. That's point 2. So the globus pallidus interna is the output from the basal ganglia to the thalamus. And then the thalamus will then send this information to the cortex, back to the cortex in that loop. And this is point 3. The cortex will then send this information to the skeletal muscle down the spinal cord to cause a smooth movement pattern, coordinated movement pattern. So those are the 3 main points: the input to the basal ganglia, the output from the basal ganglia, and then the output from the cortex again to the muscle. Now within the basal ganglia, there's a lot of interconnections happening between the glutaminergic neurons, which are the excitatory neurons, as well as the GABAergic neurons, which are your inhibitory neurons. But the most important thing in this diagram is within the substantia nigra pars compacta, because here we have dopaminergic neurons that arise. And these dopaminergic neurons, they release dopamine into the caudate striatum. So dopamine can bind onto 2 types of receptor, D1, dopamine 1, or dopamine 2. And depending on which receptor it binds to, it is either excitatory or inhibitory. So if dopamine binds onto D1 receptor, it is excitatory. So it will stimulate that neuron. If dopamine binds onto D2 receptors, dopamine will inhibit that neuron.